So today I'm going to talk to you about injury and rehab, when to use massage, and how massage can help, as well as kinesiology tape. So when I say injury, what do I mean? There's a couple different kinds. In the case of impact injury, you are hit by something or you hit something else. And in that case, there is a date and a mechanism of injury, which are very helpful to know. Same thing in the case of surgery, which absolutely is an injury. Surgery is a huge insult to the body. We know what happened and when. In the case of overuse or repetitive use injury, we know what's happened, but there's no specific date because it's happened over time. And then in the case of an unknown injury, something's hurting or something's not moving quite right, but we don't really know what's happened or when. So the phases of injury, this is mostly relevant with impact injuries and surgery. Your body goes through this repair phase. The acute phase, the inflammatory phase, that's where all the swelling happens, and that's the first 4 days. Then you move into the subacute, the repair phase, which lasts from day 5 to day 14, and then the post-acute, which can last from day 15 all the way up to 24 months. So sometimes it takes a really long time to rehab and get you back to where you were before. Anything over 3 months is considered chronic, so that's where a lot of your overuse and your repetitive use injuries come in. So why is that important? Well, depending on the type of injury and which phase you're in, massage, there's things that we can do to help you. With overuse and repetitive use injuries, we can jump in right away. There's a lot of things that we can do right out of the gate to help you get to feeling better and get back to where you want to be. In the case of impact injury or surgery, where you're in that acute phase, not always, but a lot of times we don't want to do too much to interfere with that process. As uncomfortable as that is with all that swelling serves a purpose, and we really kind of want to let the body go through that. Not always, like I said, but generally speaking. Then we move into the subacute phase, so from day 5, now we want to jump in and we want to be pretty aggressive. We want to get that swelling out of there. We want to flush that fluid out, work on range of motion and movement. A couple of things to note. If you have been using ice or NSAIDs, which are your Motrin and your ibuprofen, they can help you feel comfortable in that first phase. They certainly can. But then once you get into the phase where your body's trying to repair itself, they become a hindrance. And we generally advise people to discontinue those if possible. The other thing to note is that it's critical to put the tissue through motion beginning on day 5. So that shouldn't be painful. Sometimes it's uncomfortable because your body is guarding. It doesn't really want to move. It's hurting. But the movement that we do with the tissue doesn't cause pain. And then phase 3, you just continue to work on adhesions, range of motion, and increasing the intensity of all the things that you've been doing to rehab until you get back to where you want to be. So a couple of things. These are, I've had this up before. These are all things that I focus on. A couple of just general notes. If you have an appointment already and you become injured or you have a flare-up of your injury, don't immediately just cancel your appointment. Come in. There's a lot of things that we can do to get you feeling better. If you don't have an appointment, call. I'm going to ask you some questions trying to determine the mechanism of injury and where you are in that injury recovery phase. But there's a lot of things that we can do if you come in. The other thing I want to say is that I focus a lot on injury rehab here. That's definitely my wheelhouse and the thing that I like to focus on, but that's not all I do. You don't have to be injured or in pain to come see me. There's a lot of things that we can do for general maintenance and wellness just to keep you feeling good.